And what you may wonder they're talking about is from holding political rallies to night parties, a selective enforcement of law. Politicians and cabinet secretaries are behaving badly as pandemic ravages the country. Now, on one end, we have had several political rallies, and some have been quelled by law enforcers. But then this is seemingly based on what faction you do support as a politician. We had scenes going around on mainstream media and social media where we had Bonnie Halwale, former Kakamega senator, dousing a police officer with water, just trying to reject their efforts to, stop their political rallies that had 50 people. But on the other side, we had a 1,000 group of teachers meeting a number of CSs. So that aside, we had Senator Sakaja yesterday having to apologize after he was caught out partying after curfew hours, and it was reported that he was being protected by some senior civil servant, but then he came out and apologized unreservedly for his behavior and even wanted to, resign from the ad hoc committee. So I'll start with you, Stella Agara, who's coming to us via Zoom. What do you make of this? Is this a curse? Why aren't our leaders, leading by example?
I think the first comment I would make, Trix, is that I think our politicians are kind of losing it. We cannot be asking Kenyans to be careful, asking Kenyans to stay home and only come out with the mask, asking Kenyans to wear masks, to avoid certain public places, and then we ourselves, we are found, in those places. And you see, for politicians, they're the lawmakers, they're the ones who pass some of the regulations that we are currently living by, and then they're the very same people who go out to break those rules. For me, and from where I sit, I do not see the urgency of any political meeting. In the event that anybody wants to hold a political meeting, there are mechanisms to hold meetings. We have had, webinars of up to 1,000 people, 10,000 people, with represented with audiences from the entire continent, from my sector. We have been able to hold meetings where people are in different meeting rooms within the Zoom platforms or even WebEx. So why politicians are not using that platform to address whatever it is they need to address, I don't understand.
Now,
they are putting themselves at risk, but they're also putting the people who they live with and their family members at very high risk. And I think it's irresponsible. I think it is uncalled for, and especially when the activity you're engaging, for example, is what the Nairobi senator was found doing. I think it's very, very unfortunate for the chairman of the Senate ad hoc committee on COVID-19 to be found outside after curfew time. Yet I'm sure these rules actually passed through his committee. Now he apologized, which is great. But the circus we have been treated to is highly unnecessary, very irresponsible. And as far as I'm concerned, they need to be called to order. They need to rein themselves in. And this needs to be addressed quickly, because if they continue with this irresponsibility, Kenyans are now going to begin following on their footsteps. And then it will be survival for the fittest and the fattest. So we just need to take responsibility moving forward.
Right. And do you think then, being the chairperson of that ad hoc committee, should he then resign? For sure.
I think his resignation is in order.
Yeah.
Tricks in more developed democracies, when you are found running a company that has developed a faulty product, when you are found in the National Assembly having conducted yourself in a manner that does not bring dignity to your office, when you're found in public office appointed or employed and you're found engaging in activities that do not promote the values of the society, people resign. People resign without anybody calling for it. So the move the move he made to resign, I don't know who advised him to do so, is actually a good move. Politically, of course, it's going to dent his image a little. But then in terms of our values and integrity and morals, it is important that he resigns, because if he's not able to follow the rules that his ad hoc committee and the national platforms that are helping respond to COVID are setting up, then maybe he's not the person to be sitting in that position.
Okay.
And it's unfortunate because he's a quality leader. We know
Yes.
this value he was bringing into that committee. But then when you find yourself breaking the rules you are supposed to be promoting, you must ask yourself very serious questions as far as your integrity is concerned.
Absolutely, Stella. And of course, the biggest disappointment from what you would see on social media and the comments was given that a lot of Kenyans expect better of Senator Sakaja, given that he even came out a few weeks ago with his kids, you know, putting a good show and telling people why it's important to protect the vulnerable in our community by following the measures. So, of course, that was a bit of a disappointment for a lot of people who actually see him in much better light and hold him to a better, you know, level of responsibility. Now, when you look at page 6...
And Trix, he did not just come out, he was rewarded. Is it the Kenya Film Censorship Board, the one led by Ezekiel Mutua? He was rewarded for his children's rap song to promote the hand-washing campaign. He received public funds for promoting positive response toward COVID, and then you were caught up in some reveling somewhere. I mean, it's irresponsible.
Absolutely. Now, when you take a look at page 6 and 7, that is where the story is being expounded on. We're looking at images of these meetings that you're talking about. While some of these leaders have met with the people who support them, it's quite unfortunate that pictured right here is just flouting of those rules. In Elgeyo Marakwet, Senator Kipchumba Murkomen addresses victims of landslide, but then they were crowded. They do not have masks. Mr. Manyasi, what do you make of this particular story and how it has been covered? Is it indeed a curse, as the paper is telling us?
The issue of the... Okay. If you look at the politics as has been played out, obviously, unless you don't have a political eye, you will know what's going on. You know that it's about realignments for 2022. It's about the purge that is going on in government. It's about leaders wanting to put themselves into certain positions in
now,
terms of...
When Senator Sakaja comes out and apologizes unreservedly, taking back his words of show me the OB number, you know, saying that he was not actually caught out, and, you know, coming back and really seemingly like he sobered up and decided the right thing to do is to apologize, which is, to his credit, unprecedented. I mean, does that play positively politically for him?
Of course, he was advised. That's why he came out to do that. And therefore, the elite, some of whom I know, advised him to actually do that, to make sure that he cuts a different image, because he wants to run for governor of Nairobi in 2022. And so he needs to cut a different image than what people are used to. And so that is... basically why he actually did that. However, the Kenyans that I know, it may not add a lot of political value to that. The electorate that I know today is more concerned about other things than that. But having said that, I guess for me, yes, we have made this a very big issue because it's about leading by example. However, if you think about him being the chair of the ad hoc committee on COVID-19, my assumption will be, and I hope it is, my assumption will be that he even has clearance, because there are a few Kenyans who have clearance to actually be out there beyond the 9 p.m.
I guess the controversy comes in with what he was doing.
Yes, so that's why I was saying it's more about what they were doing in a club. If they were high, then that would be a different issue. But being out beyond the curfew hours, I would imagine that his position will have clearance because of his role in the current COVID-19 pandemic. However, having said that, that does not, for the sake of the public, because we still have Kenyans who actually believe there's no COVID. So we must act in a certain way to reassure Kenyans that this thing is serious and therefore we need to take precaution. So if we do not do that, then we perpetuate the same the same imagination that Kenyans have been having. Some of them have, I'm sure you've heard of people saying, show me someone who has COVID, show me someone who knows someone, and stories like that. So for some of us who have actually, who know people who have died of COVID, know how serious that is. But there are certain Kenyans out there who have not witnessed someone, apart from hearing the Minister for Health announcing deaths, and so and seeing some dramatic barriers happening, which in themselves have also been controversial, because we've seen other barriers of COVID-19 differing from other barriers of COVID-19. So we need to harmonize the way we look at COVID-19. And therefore, when we talk about politicians not holding public rallies, then we need to be on the same page about what that means, so that we send a very clear message to Kenyans out there that this is what it means to say social distancing. This is what we need to say. What we mean when we say that people should not hold meetings.
Yes. Now, when you look at the meetings that have been happening, very dramatic endings to some of them in Western Kenya, do you think we can have a level of self-responsibility where even the people at the grassroots would say no when they are called to a particular gathering because they know that it is not good for them?
One thing that I can tell you for free is that Kenyans will not move away from where politicians are. That's I can tell you for free. We can sit here and talk about it the entire day. Even the minister was advising Kenyans not to attend those rallies. But I think if you asked me, it's the other way around. Kenyans will attend those parties. That I want to say again, I can tell you for free that Kenyans will attend. So it's not about Kenyans being told not to attend. But it's about politicians taking responsibility to make sure that they do not get Kenyans into meetings. And therefore, when we talk about now enforcement, if politicians and leaders are not going to be part of it, then Kenyans will automatically not be part of it. But however, I think I need to say a few things about what we are witnessing. If you look at governors, Governor Paranya, for example, and I see this whole saga is about Western region, which unfortunately is also the region I come from. The Kakamega governor is in his last term. So for him, he's looking at positioning himself for the national politics. If you look at the governor for Bungoma, he's in his first term. So if you ask me, I do not understand what a governor who is in first term is doing in public rallies. It's like if Uhuru Kenyatta was to tell Kenyans today that his preoccupation is about uniting this region. We know that is important, but Kenyans are not interested about what is happening in Uganda and what's happening in Tanzania. That comes as a secondary thought for Kenyans. What is more important is what the challenges that Kenyans are going through. And therefore, for a governor of Bungoma, the challenges of people of Bungoma come first. So his political rallies and talking about Luhya unity and all that come secondary. And if he has not learned from people like Muhisa Kitui, who ended up telling people, the electorate, at that time, that they were busy on international trips. People actually send him home so that he can do international trips. So the realization, the governors have been given resources at the county level to serve people at that level. So this preoccupation with national politics is something that should come secondary to their responsibilities.
What is happening right now, the more serious issues. Now, remember, you can be a part of the conversation by telling us what you think. The question this morning is, do you think counties have the capacity to effectively test for COVID-19? I'm at Trix Ingado, and the hashtag to use this morning is KTN Morning Express. Let us know what you think, and I will be sampling your views as we go along with the show. But of course, let's continue with what's happening in the front pages, and we are being asked this morning, where are the county billions? And far from that, we also have, of course, across board the showcasing, or rather the reporting of Papa Shirandula's burial. Mr. Manyasi was talking about, do you know someone who has suffered from COVID-19? As time goes by, increasingly we are seeing now people who are in the public eye who have gotten COVID-19, just acting as proof that this is real. We had Jeff Koinange, who is a veteran journalist in this country, coming out to say that he has tested positive for COVID-19, but of course without symptoms. But he says he's okay, and he was thanking his employees for the support. So when it comes to taking this seriously, Stella, what do you make of this developing, increasing spread of COVID-19? After the counties were opened up, it seems like there was a spike, and we are seeing a more dangerous situation unfolding as we go along. And do you think the counties are capable even of testing to the capacity that would enable all of us to be safe and more aware of our situation?
Trix, I was on this very show, I think, doing a weekly review just after the president had partially reopened the country. And within the first few days, we had started recording up to 400 cases a day.
Yes.
And I remember predicting that by the time the 21 days are over, we are likely to get the kind of lockdown that Kenyans have been fighting since the beginning of this pandemic. And the reason why we're likely to get that is because our behavior has not changed. Notice that bars have not been opened in this country. Within the directives given, nowhere did the president mention that bars are actually open.
Meant to be,
But for some strange reason, you're finding people gathering in bars. The question we should be asking ourselves is, who is the owner of this bar? Why are they opening this bar for people to come and hang out and drink? And as they hang out to drink, are they practicing the social distancing measures that have been recommended by the Ministry of Health?
Yeah.
The conduct of Kenyans, even as far as mask efficacy. I was watching the apology by Senator Sakaja, and one of the gentlemen standing on his left was wearing his mask under his nose. And he was listening very attentively to Senator Sakaja making the apology. And I'm thinking to myself, I don't know whether you having your mask under your nose is worse than Senator Sakaja being caught in a bar after curfew time, And you see, one may assume that because they're wearing a mask and sometimes they pull it down to their chin, they think they're safe. Any part of your body that is exposed is interacting with the kind of germs that will be sitting on top of that mask.
Yeah.
But that is not something that Kenyans have understood now, and they're therefore not practicing social distancing. They're not practicing mask efficacy. They are also succumbing to familiarity. You wear your mask for as long as you're with strangers or in a crowd, and then when you come close to familiar people, you remove the mask, assuming they're good. Because of that, and the fact that we have opened up our economy, we are having more cases. Unfortunately, this is not a trend that has started in Kenya. This is a trend that is happening elsewhere. Luxembourg, as a country, has already shut down again. Germany is beginning to experience an influx of a surge of infections. We have seen what happened in most of the states that irresponsibly reopened and gave optional mask practice, and some of them, like I think Florida, have actually now decided that they're going to promote mandates mask application. Kenyans must understand that if this disease gets out of hand, we cannot continue as usual. We now have 13,000 cases. This is double what we had at the time the president reopened.
Absolutely. Mr.
So
Manyasi,
that should
Stella,
be
I'd like to bring in Mr.
sign of what is
Manyasi.
coming.
Yeah.
I had promised that by the time the president comes back to lock down the country, you will not tell him you need food, whatever, because it gives you time to go and make money and make sure you're surviving under the circumstances, and then you use the time to go and engage in responsible activities that are promoting infection.
Right.
Even
Mr. Manyasi, Stella, let's have Mr. Manyasi weigh in on this conversation.
Now, about having...
I don't know if she can hear me. But Mr. Manyasi, what do you make of this particular conversation? The county preparedness.
One of the things that is a bit worrying is that part of why counties, there's a worry about the fact that the country opened. Of course, it was also the president, I can understand where he was coming from in terms of the economic implications. And you saw when he opened, there are so many Kenyans who actually traveled out of Nairobi because they were stuck, their jobs were gone, and they were unable to pay rent, and they were unable to even feed themselves. And so some of them actually decided to take their kids up country so that they can come back and hustle, the word that we use. And so the counties, as it now, why the numbers are soaring so high is because Kenyans have taken the virus to the upcountry, to their home areas. And of course, Nairobi is still growing. But having said that, the counties have no capacity. If you look at the level of preparedness, I was telling someone that I was talking to a friend of mine who is in the US, who is running a camp, an isolation camp of 5,000.
Yes.
And he was telling me how it's a tent, but it's been done in such a way that every person is actually isolated completely. Right. There's no interaction whatsoever. If you look at the setting up of the counties in terms of isolation, then you start wondering whether, if this disease was to get out of hand, whether even those isolation camps in themselves will not be breeding grounds, and I hope they will not be. So the capacity...
I think it's not even a matter of whether or not. They are, in many cases, breeding grounds, and this has been documented.
And it has happened even in Nairobi, where some people have actually contracted and they were negative, and so they interacted with the people at the camp because of the procedure set up. And so we hope that as the counties are given more time, the unfortunate bit, it comes back to politics. When you look at the way the governors are giving priority to issues which are not priority at the moment, at this point in time, it's about the governor safeguarding the life of Kenyans. Health is devolved. However, in national emergencies like this, then the interaction between national and county government, and the counties have been given, I think, something like close to 5 billion shillings to look at preparedness. And so if you ask me, I would think that the counties are not halfway through the preparedness. And you see, it's not just about setting aside isolation centers. It's also about the number of beds available in case people need specialized treatment. It's also about, for example, can you go to a market today in the counties and find that that market and that bus park has enough hand washing stations, that people are adhering to distancing, that the markets, the people who are selling wares at the markets, of course Kenyans need to eat, but is it possible that all these measures have been put in place? If you asked me, I would say that that is far from where we should be. And therefore, some of us are worried that if we continue this way, then if it gets out of hand, then we are going to have more complicated things to think about.
And the papers are telling us this morning that the rising number of numbers push a state to rethink the projection of the peak. We are right now over 13,771 positive cases, and this is projected to be something that is still rising. Stella, when you see the rising number, and this breakdown on page 4 has indicated certain amounts to the millions that have been put aside for the fight against COVID-19. We have for monies for medical supplies, response capacity, quarantine, isolation, and the amounts used to cushion the economy through various social support programs. But at the same time, we are having people going out of business, and a lot of people have not felt where these monies have gone. We are having even projects that are meant to, funds that are meant to go to, implementation and monitoring, as well as communicating to the localities and educating people on how to deal with COVID-19. But when you ask around, you're told by the electorate, the people at the grassroots, they do not feel where these funds are going. Do you think we have missed the ball in terms of prioritizing these funds, or even just putting them to good use?
Trish, I think, let me first say, the moment COVID funds are mentioned, for me, the first thing that comes to my mind is vigilance. And I must register now that I'm extremely worried about the integrity of the individuals who are going to be handling these resources. We know we have a history as a country, so we know the kind of people who are going to be handling these resources. We know the records they have of engaging in corruption. So one of the things that I'm extremely worried about is matters of corruption and how these funds are going to be expended. If you ask me if I have solutions as of now, unfortunately, I don't. It's something I'm still thinking through. But there needs to be a mechanism through which citizens are going to monitor the expenditure of these resources in the county. But having said that, there are a number of initiatives that are being done to ensure that the support reaches the citizens. I don't know how much of the government resources have gone into supporting the citizens, but I know there are civil society organizations that have supported citizens tremendously, and they're running these initiatives through Give Direct and Segovia, who have been sending money to families in the informal sector. I'm also aware that there are people who are already registered under our social welfare programs who have been receiving support, and mostly orphans, vulnerable children, and the elderly who have been receiving support from the government, and therefore the government just topped up the figure a little so that it can cover them during this period. However, there is a huge group of people who are also struggling, and there's also the group, Trish, that is going to transition from being stable, from being able to depend on themselves, and transition into the vulnerable groups.
Yes, absolutely.
And as at the beginning of this pandemic, they are not viewed as needy, they are not viewed as struggling. But with the kind of rent struggles we have been having, with the kind of limited resources, job losses, there are certain groups that are going to transition, and those groups have not been reached yet. And I don't some form of an algorithm has been set up to establish how these people will be identified and resources reach them. But as it is, the most vulnerable people have not been assisted yet. Had they been assisted, I think the call to be out here and hustle would have been smaller.
Absolutely.
Unfortunately, we also haven't had a proper, broad system of protecting the citizenry, and therefore, when the problem began, mechanism for identifying who would be receiving these resources did not exist.
Stella, well, thank you. We have run out of time. Let's take a look at our question of the day. We're asking you, do you think counties have the capacity to effectively test